Let's talk about alcohol abuse and other substance abuse. So, for alcohol abuse, um, if you have 3 drinks per occasion or 7 drinks during the week, you're at risk alcohol use, or any drinks during pregnancy, you're called at risk alcohol use. Binge drinking is 3 drinks at any occasion. Moderate drinking is 1 drink a day. Health effects: 40% increase in breast cancer, unplanned pregnancy, altered fertility, STI, seizures, cardiomyopathies. Identification of at-risk drinking: we do a universal screening annually, and at each pregnancy we use the TASTE, mnemonic, tolerance, annoyed, cut down, eye opener. Any 2 or more points is a positive screen. Alcohol use during pregnancy and breastfeeding. Binge drinking is greater than 4 drinks on each occasion, and drinking throughout pregnancy are considered particularly harmful. Fetal alcohol syndrome: it's about 1.5% prevalence rate in the US, with central nervous system anomalies, growth defects, facial dysmorphia, impaired intellectual development, FGR, and microcephaly. Low-level consumption of alcohol in early pregnancy is not an indication for pregnancy termination. Reduced milk production: we should wait 4 hours after a drink before breastfeeding. And also, there's no established threshold for alcohol. Other substance abuse: meth. 5% of American 12 years or older has tried meth at some point in their life. It increases dopamine release and blocks reuptake. Pregnancy side effect: SGR, no teratogenic effects found. Abnormal neurodevelopment in the neonates has been found. There's a reduce in milk production. Should not be breastfeeding if actively using, due to high levels found in breast milk. It's about 7 times higher than maternal serum. Treatment is cognitive behavior therapy. There is no pharmacologic treatment. Smoking: babies at risk for orophacial cleft, FGR, placenta previa and abruption, PPROM, low birth weight, increased perinatal mortality, ectopic pregnancy, and decreased maternal thyroid function. After delivery, the neonate is at risk for respiratory infection, asthma, infantile colic, bone fractures, and childhood obesity, and increase in SIDS. Epidemiology: 10% of pregnant women smokes. 50% of women will quit smoking before or during pregnancy. Interventions: motivational interview, cognitive behavioral therapy, 5 A's of intervention: ask, advise, assess, assist, arrange. National quit line. Great benefit if a cessation is less than 15 weeks. Pharmacotherapy, varenicline, and bupropion. Less than 300 milligrams show low level of detection in breast milk, do not demonstrate increased risk for congenital anomalies or preterm deliveries or low birth weight. Marijuana, 5% of pregnancy. Smoking is 10%. Marijuana is 5%. 10% of maternal THC level in the fetus can be seen after consumption. Cannabinoids receptor on the fetal brain is noted at 14 weeks. Can interfere with normal brain development. Lower test score on visual related tests. Decreased attention span and behavior problems. Possible increase in stillbirth. Increased low birth weight. 2,500 gram and preterm birth with weekly use. Should be discouraged during breastfeeding due to lack of data. Lead exposure: 1% of childbearing women have serum lead level of 5 micrograms per deciliter. Chelation therapy is considered for 40 microgram per deciliter if patient is symptomatic. 70 microgram per deciliter is considered an emergency. In children, 45 microgram per deciliter is treated. Main target of lead toxicity is the nervous system. In prenatal exposures can lead to gestational hypertension, spontaneous abortion, SGR, impaired neurodevelopment. Breastfeeding: non-breastfed infant can have a higher lead level than breastfed infants due to lead contamination in the formula. Screening and management: universal screening is not recommended. Screen only if there is a risk factor such as working at like a lead factory or something, or recent remodeling of an old house. Greater than 5 mics per deciliter needs further investigation of the source. Greater than 45 microgram should be treated. Initial lead level will drop rapidly once source is eliminated, then slow decrease over several months to years. Daily calcium of 500 milligram and 80 milligram of iron is recommended. And during lactation, it is safe to breastfeed if the serum level is less than 40 micrograms per deciliter. The infant blood lead level should be monitored. If it's greater than 5, then breastfeeding should be discontinued. If your serum lead level is more than 40 micrograms per deciliter, discard the breast milk, eliminate the source, check the level every 1 to 2 weeks. Increase calcium intake to 120 milligrams daily. Can decrease or decrease.